everyone, this is Shay Lehman. I'm here to talk to you about family reunification for family in the court system with Dr. Ruger. Reunification fulfills a child's right to live with family is a statement you will find from an article written by Tom Rawlings. He's the current director of Georgia Department of Child and Family Services, also known as DFACS. It's the utmost priority for child and family services workers to keep families together. It seems a strong statement to state reunification as the child's right. Both children and mind, these organizations push for this unity as their primary goal. In the state of Georgia alone, there were 5,671 families served by Family Preservation Services in 2020. And what that means is that we worked to get these families back together. These children would go to someone in their family, whether it be grandma, whether it be an aunt or uncle. And you can see right here in this area, the number of family preservation services, the number of investigations started in the state of Georgia. And you can also see, the timeline of children in foster care by months, by their age, by their sex. The state of Georgia has several different statistics that you can look at here. Re-entry into foster care, discharges to permanency, and these tell us, a lot of different information about the children that are being adopted and why they're being adopted. Data reflected in the Georgia DHS database also shows that every year from 2017 until current, reunification has been the primary reason for children leaving the foster care system, which is, more proof to us that that's what they're pushing to do. According to the most up-to-date information from childwelfare.gov, when children must be removed from their families to ensure their safety, the first goal is to reunite them with their families as soon as possible. And this organization works with several other leading organizations for children. And it is always, any organization that you're working with, it is their utmost priority to reunify families. You can see here, this organization is, in partnership with the U.S. Department of Health and Human Services, the Administration for Children and Families, and also the Children's Bureau. And, our very first sentence is what I just told you. When children must be removed from their families to ensure their safety, the first goal is to reunite them. And it gives us a list of ways that they help to reunite these families. There are several different programs that are used. They use several different ways to find the root cause that these children were removed. The organization states that reunification is done in multiple ways, but they're all centered on finding the root cause of the child's removal from the home to begin with. The programs that they have focus on finding solutions and remedies to these problems that get them, into these situations to begin with. And they use caseworkers as subject matter experts, and they use them to help the family find what the root cause is, but also to find resources for them and to help them meet in the middle. Title IVB and IDE of the Court Improvement Program set forth by the Administration for Children and Families, which is called ACF, examines the outcome of children whose families work together through the programs provided to create safe and healthy living environments. So they examine these areas of improvement that we give these families, and we say, you need to work on X, Y, and Z. These are the programs, and this is how it's going to work. And they have several of these programs listed out, that kind of look like this or set up like this, and they're pretty long documents. And, they detail a lot of different things in there, a lot of different data. And one of the things it shows us, an analysis of the data on exits for children shows us that while over 85% of children and youth will eventually achieve permanency through reunification, guardianship, or adoption, less than 50% will return to their families of origin. So they feel like, that's kind of a sticking point, and that's somewhere that they really want to improve. The study found that families who were encouraged to put in the effort and work the programs had higher rates of success for reunification and a reduction in time that their children spent in the foster care system prior to them being reunified. Several points were studied, one of which was the ability to keep siblings together. The second was exploring existing familial relationships, aunts, uncles, grandparents, and keeping children in their communities. All three of these were found to be more advantageous with a better outcome when it was possible to accommodate. The children had much better outcomes when they were able to stay in the community that they know, stay in their school, stay around their friends, people that they know. Being removed from their home is already a traumatic situation, so being able to keep them around people and places that they know made for a better outcome for the children. It can be noted, the study also found that children of parents who had signed over parental rights were at a significant disadvantage of reunification with other kin prior to aging out of the system. So when their parents, signed over those rights, it made it harder for them to be placed back with grandma, grandpa, that sort of thing. The Drug and Alcohol Abuse Institute, along with the University of Washington, found several studies that find it, best to place children back in familial settings when, it's safe, not whenever we have drug addicted or substance addicted parents. And, our research has shown that substance abusing mothers who had a child removed from their care were twice as likely to have a subsequent birth and 3 times as likely to have a subsequent alcohol or drug exposed birth. The team, conducting the study found there is hope on the other end, but it requires us to be more proactive than reactive to these mothers. A family and drug treatment program has been created in many areas and can be managed and ran by the court system. The program was created in hopes of reducing the maltreatment of children by treating the immediate issue of drug and alcohol dependency. In contrast to adult drug treatment courts, this allows social workers, attorneys, guardian ad litem, the Department of Social Services, anyone to give that referral for those parents. Through investigation and study, we can see that reunification is the ultimate goal for all children and families, but only when it's safe and healthy. The court's ability to assist and monitor these substance abuse issues has grown over the years. We have several systems in place that now allow us to detect and treat early and give robust help with substance abuse and mental health issues and parenting skills.